Being outside helps with overall well-being. It improves mood. There are endorphins that the body produces that helps with the cardiovascular system. But also, very importantly, the sun helps us to make vitamin D. Having said that, there are also a lot of complications that can happen from being exposed to sunlight for too long. We should limit how much time we spend outside during the period of the day when the sun's intensity is at its maximum. So between the hours of 11 and 1, we should try not to be outside for any prolonged period because that's when the UV exposure risk is extremely high. If we are exposed to too much UV radiation, these cells tend to overwork and they become tumorous. And you may have heard the term melanoma. Up to 2% of patients with melanomas progress to skin cancer. We should be looking at sunscreen that is defined as broad spectrum and that also has an SPF factor that is greater than 30. And I know there are several formulations that market themselves as being waterproof. The jury is still out on whether or not they are completely waterproof. My recommendation is that we reapply and continue to reapply. So a lot of people become confused when they hear these terms, and just to understand, heat exhaustion is one condition along that spectrum of heat-related illnesses. At the end of the spectrum where a patient is critically ill, that condition is called heat stroke. And the symptoms of heat stroke include hemodynamic instability, meaning that their blood pressure is very low, their pulse rate is very fast, their oxygen levels are very low, they have difficulty breathing, and very importantly, they also have neurological symptoms. And this means that they may have seizures, they may have generalized weakness, and recurrent fainting episodes. Heat exhaustion is actually early on in the spectrum of heat-related illness. And the symptoms are a lot different in that patients may have excessive sweating, they may feel nauseous, they may vomit, they may also feel lightheaded, but they don't have any classic neurological symptoms. One of the other big differences between heat stroke and heat exhaustion is that patients with heat exhaustion still have the capacity to auto-regulate their temperature. So staying hydrated is extremely important. One way of knowing if you're adequately hydrating is if you're going to the washroom at least once every 2 hours. But we also see a fair amount of cervical spine injuries associated with diving in shallow water. So one thing to remind people as they go outdoors, they should not be diving headfirst if they can't tell how deep the water is. We do see cases from time to time where young people have complete spinal cord injuries and remain paralyzed for the rest of their life. So we should all exercise safety when swimming, and I'd like to re-emphasize the point that alcohol and swimming does not mix. We do see a fair amount of alcohol-related near-drowning cases, and this is certainly something that can be prevented. Stay safe, remain hydrated, wear sunscreen, drink responsibly, and remember the restrictions with regards to COVID.